The algorithm thinks this channel is a museum of short attention spans, 12-second latte art, gym mirrors, and reels where I treated pharmacology like slam poetry. Today, the tour guide has changed. No trending audio, no dancing scalpel, just me, a repentant scroller, confessing that this channel is rebooting with the most gloriously difficult love story in medicine, human anatomy. If you've ever wanted to swap doom scrolling for dissecting and trade double tap for transverse plane, this is your invitation. Consider this the orientation speech the Cadaver Lab never gives you. Because the Cadaver Lab believes in learning by mild emotional whiplash. Anatomy is the first subject that convinces you medicine isn't an abstract dream. It's ligaments that squeak under your forceps and arteries that sulk when you nick them. In MBBS and BHMS alike, it's the foundation stone: osteology, arthrology, myology, angiography, neuroanatomy, embryology, radiological anatomy, surface anatomy, the grand buffet where you pretend to be a minimalist and then return with 5 plates. It's the only class where your notes smell faintly of formalin and hubris. The day you meet your first corpse is the day your inner comedian goes respectfully silent. You sign the register with shaking hands. Someone over-sharpens a pencil like we're about to take the SAT of souls. You step in, and the room looks like a cathedral that converted itself into a lab. Reverence first, then reality. The shoulders square, the gloves snap, and the prosector announces, skin incision along the midline. You learn quickly that midline isn't a guess, it's an allegiance. The scalpel doesn't care about your aesthetic, it cares about layers. Skin, superficial fascia, deep fascia. Like the internet, most of the drama is superficial, but the real infrastructure lives under the spam. Osteology arrives like the minimalist cousin who actually pays rent. The bones are honest, ridges, tubercles, grooves, all quietly whispering, a muscle lives here, a vessel crawled there, a nerve complained here. You hold a femur and feel the weight of civilization's poor ergonomic decisions. The humerus makes puns of itself, but the surgical neck fracture does not laugh back. You memorize foramina like they're passwords you can't save in the cloud. Supraorbital notch, infraorbital foramen, mental foramen. Tiny doors in a skull that's basically a gated community for cranial nerves which are dramatically sensitive to trespass. Joints are where bones negotiate their relationship status. Some are flings, plain joints, some are stable partnerships, hinges, and some are chaotic polycules. Shoulder, I'm looking at you. You learn the difference between stability and mobility, and how the body rarely gives you both in equal measure. The knee is a marvel of engineering until your patient insists on playing weekend football in shoes older than your atlas. Muscles, the overachievers. Origins and insertions become your love language. The trapezius is that reliable friend who shows up early. The rotator cuff quartet is your group chat. Supraspinatus always typing. Subscapularis a cryptic introvert. Infraspinatus with memes. Teres minor with receipts. Somewhere in a corner, psoas is plotting back pain like a Shakespearean villain. Neuroanatomy is not a chapter, it's a haunted house with excellent signage. Cranial nerves emerge like cast members from the world's most niche television show. 3. V. 6. Direct eye movement with bureaucratic precision. V. Offers sensory gossip from the face. 7. Curates facial expressions for selfies and sorrow. The brachial plexus arrives as a Vedic hymn disguised as spaghetti. Roots, trunks, divisions, chords, branches. You will draw it on napkins, forearms, whiteboards, and once, during an especially desperate night, on the back of your hand in permanent marker. The day it finally clicks, you feel like you've been invited to a group chat that previously banned you. Blood supply is the city's public transit. Arteries are the punctual trains. Veins are the after-party carpools. The abdominal aorta is the main highway where everyone emerges badly after the renal exits. If you think anastomosis is just a fancy word, wait until collateral circulation saves your surgical plan like a deus ex machina. Nerves are the city's conspiracy theorists, whispered, winding, maddeningly particular. One compression, and carpal tunnel writes a Yelp review in 5 fingers. Topographical anatomy is the spiritual cousin of Google Maps. Surface landmarks become your compass. Jugular notch, sternal angle, costal margin, ACEs, tibial tuberosity. No scan, no problem. Your fingertips read the braille of the body. You can locate the apex beat with more reliability than you can locate motivation on a Monday. Embryology sneaks in. The plot twist that explains almost everything. Week 4, the heart loops. Week 5, arches migrate. Week 6, the limb buds rotate like they're auditioning for a choreography competition. A millimeter's misadventure, and now you're counseling a family about a congenital anomaly. Embryology teaches humility. Humans look inevitable only in retrospect. Histology appears as anatomy's whisper track. You squint at pink and purple and insist you can absolutely tell the difference between a simple columnar epithelium and a stratified squamous. 2 coffees later you can. Goblet cells flaunt their mucin like they own the slide. Cilia beat quiet time signatures you can almost hear if the library is silent enough. The orthodox librarian knows this look in your eyes. She appears without footsteps, materializes at your table, taps the glass, and says, "Magnify your patience." She's right. She is always right. She probably invented eosin. Radiological anatomy is the same city under different weather. X-ray gives you silhouettes. CT gives you cross-sections. MRI whispers water's secrets. Ultrasound is the interactive map that answers only if your probe manners are impeccable. The first time you navigate an axial CT through the thorax without panicking, you feel like a submarine captain who finally found north. The clavicle becomes your North Star. Trust the clavicle. Cadaver lab etiquette deserves its own constitution. No food, no phones, no loose talk. Respect the donor, respect the team, respect the plan. And yet, life leaks in. Breakups and patch-ups happen between layers of superficial fascia. Someone cries into a surgical mask, not because the dissection is hard, but because the text they were preparing for never arrived. The paradox of the lab. You are closest to death while becoming intensely aware of the life you carry back out. I have watched classmates stitch relationships together over a brachial plexus while someone else quietly negotiates a goodbye over the iliac crest. The body teaches endings and origins without a single word. Hierarchy shows up early and everywhere. Cranky seniors wield the phrase basic concept like a cudgel. Cranky juniors discover sarcasm before ethics. You learn to stand your ground kindly. I don't know yet becomes a power move when followed by, here's how I'll find out. And when the millennial uncle corners you at a wedding to announce that shoulder pain is stored trauma and can be resolved by moon water, you nod, you breathe, and you say, the rotator cuff has a counter-argument. Would you like to hear it? He wouldn't. He never would. But someone at the table will, and that's your person. Night duty, before the degree pays real rent, teaches anatomy with consequences. As a junior medical officer in a small private hospital, I learned the sternal angle through chest pain and fear. I learned the intercostal spaces by placing an IV in light that made everyone look like a moral dilemma. I learned the neck triangles by chasing a vein that refused to be seen. Anatomy at night is a different book, less Latin, more human. You don't quote Gray's, you channel it. And then there's the part-time job in the outside world, where anatomy and power dynamics collide in fluorescent lighting. The manager asks if you can lift just this one pallet alone. Your vertebrae files a class action lawsuit in your mind. You reply, 2-person lift for spine safety, in a tone you perfected during your lecture on the anterior longitudinal ligament. The policy meets the posterior chain. Sometimes you win. Sometimes you remember that saying no is anatomy of the soul. Boundaries attached to bone. Back to the lab. The thorax is a cathedral of compartments. Mediastinum like a VIP lounge. Superior, anterior, middle, posterior. Each with a guest list of nerves and vessels that pretend they're not late. The heart sits with the arrogance of someone who knows you can't fire them. Chambers, valves, coronary arteries plotting turf wars around impossible curves. Lungs lounge like overbooked guests, pushing and retreating with the diaphragm's tides. You put your hand beneath the costal margin and feel the dome rise on inspiration. It is the one magic trick that never gets old. The abdomen is politics. Everyone claims land, no one respects borders. Mesentery sling loops like zip lines across a canyon. The liver is a golden retriever who forgot how big it is. The pancreas hides in plain sight, flimsy and fatal if offended. The spleen is an introvert who bleeds spectacularly when started. Hernias are little rebellions at the inguinal ring, because of course the abdominal wall would offer shortcuts. Anatomy is history. Everything valuable needs an exit strategy. The pelvis is architecture plus diplomacy. Bones with personality, ligaments that spell no further. Organs that share an address, not because they get along, but because there's no space anywhere else. Obstetric diameters teach you logistics. Perineal pouches teach you humility. You acquire a new respect for gravity and Kegels. If you giggle at ischial spine, enjoy it now. The exam will remove your sense of humor for 48 hours. Head and Neck is a mini-series with too many beloved characters. Parotid glands hires facial nerve as a roommate, and then refuses to let them pass without drama. The orbit is a mechanical miracle. Fat, muscle, nerves, vessels, and a tiny bone called lacrimal that holds the faucet for your feelings. The tongue has more muscles than your group project has excuses. The pharynx decides whether you breathe or aspirate based on a vote you can't audit. The larynx is your personality's bouncer. Treat it kindly. Spine. The body's paradox. Flexible column. Cervical spine pretends it's a gymnast until Whiplash writes a memoir. Thoracic spine is conservative in motion, but generous in stability. Lumbar spine shoulders everyone else's drama and then gets blamed for existing. Sacrum is the elder who claims to be aloof but bears the whole family. Coccyx is the punctuation mark that hurts when you fall. Dermatomes draw their pastel territories over the map like candy-colored mayoralties. Shingles reminds you they're not just cute diagrams. Clinical anatomy sprinkles seasoning over everything. Surgical incisions respect Langer's lines because scars respect poetry. Nerve lesions leave calling cards. Wrist drop for radial nerve, claw hand for ulnar, ape thumb for median. Mnemonics with tiny tragedies baked in. Fracture patterns tell stories. Colles, Smith, boxers, names and eponyms that translate trauma into teaching points. Carpal tunnel is an architectural complaint. Sciatica is a landlord with an eviction notice that you beg to negotiate. BHMS students, you dance the same waltz, layers, planes, relations, because the therapeutics you'll choose, the case-taking you'll craft, the repertory you'll navigate, all demand you know where a symptom lives, where it travels, and which nerve likes to gossip about it. The material may differ later, the map does not. Understanding the ribcage is understanding the feeling of breath. Understanding the skull base is understanding why headaches throw their pain like ventriloquists. Study culture wraps around anatomy like fascia. Seniors who snap, juniors who eye-roll, batchmates who confuse cruelty with rigor, consider them physiological stress tests. You will develop scripts for sanity. Teach me, don't test me. I don't know yet. Give me the landmark. Let's verify in the atlas. The librarian will glare your soul into better posture. Accept it. The glare is pedagogy. And to my frenzied circle posting best couple ever reels while I trace the coronary groove at 2 a.m. I see you. Love is not an anatomical space, but it does require a pericardium. Boundaries that protect the beat while allowing movement. Relationships aren't flexion without extension. They are opposites making a range of motion. If your romance can't pronate and supinate, it's just a locked elbow. Let the joint move. So why launch this channel Reset with Anatomy? Because it is the first honest mirror we hold up to the idea of being a doctor. Not the quote board version, the real one. What is under the skin, how it holds together, where it breaks, and how we can earn the right to fix it. Because this subject turns awe into competence and fear into technique. Because once you learn to respect fascia, you stop tolerating flimsy arguments. Once you trace a nerve's path, you start tracing your own decisions with similar care. Once you honor a donor, you walk out of the lab and start honoring time. On this channel, reels become regions, swipes become sections, and loops become loops of Henley only when appropriate. No dialogues today, just this monologue, one voice, both contrite and caffeinated. Promising that if you stay, you'll learn to see the human body with the kind of attention that turns scrolling thumbs into healing hands. Cranky seniors will still be cranky. Millennial uncles will still forward remedies involving the moon and turmeric. Managers will still test your spine's tensile strength. Friends will still post cinematic kisses. And librarians will still protect silence like a threatened species. But you will change. You'll start to map patterns on moving people, not just pages. You'll learn to speak in landmarks, think in layers, and act with the calm that anatomy quietly installs when you finally know what lies beneath your fingers. Welcome to the reboot. Gloves on, chin up, Midline found.